Good morning. So I am currently on my way to my gyne oncology appointment this morning. I have been having issues with my ovaries for a couple years now, but within the last 2 years they kind of have gotten worse, especially on my right side. So my OB doctor recommended that I see a gyne oncologist, so I am on my way to go and see them. I did decide to record this only because it won't be getting, like, my ovaries will not be progressing anytime soon, so I kind of want to get anyone experiencing this will, if they don't know what to do, what direction to take, I'm just hoping that this video might help someone. So I just arrived to the Cancer Institute. It's kind of nerve-wracking, especially like before the appointment. Like, you don't really have too many thoughts, but then when you actually go, it's a lot that's going through your mind. So so I am here waiting for the doctor.
Ovarian cancer or cervical cancer, uterine cancer?
I know I spoke with my aunt, and she was saying that we had a history of cancer, but I never clarified exactly which cancer it was.
Okay. And was it in the females that
female side?
Okay. But you don't know, like, which family members were impacted by the cancer? Okay, gotcha. But as far as you know, your mom, grandma, so far doesn't have any sort of, like, ovarian or anything like that? Okay. And you've never been a smoker?
No.
Okay. Gotcha. All right. And it seems like you're not having any other symptoms besides this kind of abdominal thing that happens. Okay. All right. Let's see. Okay, and you're not taking any medications? Nope. Okay, and any other medical issues that you see doctors for, like asthma, blood pressure, high cholesterol, anything? Okay, very healthy. Love it.
Besides this.
Exactly. All right, and you said your last menstrual period was like early this month?
It was today.
Oh, it was today.
It just started.
Oh, it just started. Oh, I see, 13th, not the 3rd. Okay, got it. Okay, and is it still on the heavier side today?
It's kind of light today.
Today. Okay, got it. So today, are you pain-free or is
it's cramping.
It's cramping right now. Okay, gotcha. All right, well, let me go ahead and take a listen and just do a quick abdominal exam. Nice deep breath. In and out. One more time. In and out. Right, and lean backwards for me. Take a listen. Okay. And do you have any nausea or vomiting with eating?
Nausea. But it's before eating, though.
That's before eating?
Normally before.
And have you had that all your life, or is this new?
I started realizing it around last year.
Around last year? And are you, like, very consistently nauseous before eating?
Yeah, most of the time. And then after I, like, force myself to eat, then it goes away.
Okay, got it. Okay.
So it could just be, like, hunger,
nausea. Okay, I'm just going to take a feel of your neck, okay? Okay, and lift this arm for me. All right, sorry if it tickles a little bit. Okay, the other side. Thank you. Okay, great. And I'm just going to take a feel of your stomach. Okay. Any pain with me pressing?
Not there.
What about here?
It gets sore on that side, but it's no pain. Like, not.
Okay. And so my pressing isn't making it worse. It's just constantly there. Got it. Okay.
Okay, that all feels normal.
Alright, and are you having any symptoms like after you eat even just a little bit, you get really bloated or feel really quickly full or anything?
No.
No, okay. And are you having normal bowel movements,
Yes.
like not constipated or diarrhea?
Mm-mm.
Okay. And when you're urinating, it's not hurting,
Mm-mm.
and you're urinating without any issues?
Nope.
Okay, okay. Perfect. All right, so I'll be right back with Dr. Levinson, and we'll do a pelvic exam, and then we'll kind of talk to you about what our recommendations are.
Okay, thank you.
Of course.
For the privacy of the doctors, that's why, of course, a lot of the recordings is blurred out.
Hi there, how are you?
Good, how are you?
Good, I'm Dr. Levinson. It's nice to meet
You
you.
too.
This is Jen. She's the nurse who works with me. All right, my friend. So we've been reviewing all of your records and kind of your history here. Sounds like you've had kind of some time with all of these ups and downs with different cysts and what's kind of gone on with you.
Yes.
But sounds like right now this is kind of bothering you.
Yeah.
Causing some pain and discomfort.
Mm-hmm.
Is it similar to what you had in the past?
No.
Different?
Yes.
How so?
The pain just got more severe.
Okay.
Mm-hmm.
When you say it just got more severe, like, did you have like a pain episode, or you just feel
I did had a pain episode last year to where I couldn't stand up. Like it was like I wasn't sure if I was like pregnant in my tubes or something, like what's going on, and I contacted, of course, Dr. Burke and let him know, and then that's when all this
the sonogram and everything else.
Yeah.
Okay. So I'm going to talk to you a little bit about kind of what we see on the ultrasound, kind of what I think about it, and kind of what I think we should do, okay? So we do see these kind of multiple cysts that are on the ovary, and it looks like they're kind of multiple cysts that are kind of together, forming overall what we call a complex. Okay, and they're about 7 centimeters, so not small. Almost 8 centimeters, actually, so maybe like that. Yeah. Okay, so that's pretty good size for an ovary. Your ovary should be kind of like that. And so we know that even when you have cysts on the ovary, that can like cause some twisting and turning. And one of the things that we worry about is, could there be a time when the ovary could kind of flip over on itself and cause a severe pain episode, perhaps like what you had. Yeah. But it is one of the things that we worry about. And certainly when we have something that's 8 centimeters, it can cause some discomfort in some sorts of ways. Really hard to know if the ovary is exactly what's causing your discomfort or not, because many times people don't feel their ovaries at all, but some people do. Right. Whenever we have cysts on the ovaries, we basically divide them into 2 categories, okay? We either call them simple, which basically means it's just one little cyst that looks like a simple little water balloon, or complex, which is everything else, okay? The normal function of the ovary is to produce a cyst every month when you ovulate, and so when we see something that's just like that simple little water balloon, we usually kind of go, great, normal function of the ovary, that's all well and good. But anytime we see something complex, we kind of have to think about what does that represent, and is there something that could be more worrisome? When we look on the ultrasound, there's no way for us to know exactly what a cyst represents. And we don't biopsy ovaries because of the risk of spreading a cancer if there were to be a cancer there. So basically we have to kind of use the tools that we have and then decide, are we going to watch it or are we going to take it out? Okay. And there's a couple of different things that lead us in one way or another. Things that we see on an ultrasound, like if we see solid components, if we see what we call like little papillations or projections into the cyst, if something is really growing steadily over time, those are all things that make us go, no, yeah, we got to get it out. Other things, of course, are pain, quite honestly, or like real discomfort from a cyst. And then also size plays a role for us because of this issue of if an ovary were to torse or flip and those kinds of things. And then obviously those things need to be weighed against kind of, you know, the utility of your ovary. Are you using it for fertility and those kinds of things? Okay. In your particular setting, obviously you've had a tubal ligation, so I'm making the assumption that you're not planning for more children in your future.
No, I was planning at the time, it was like done, but I was like, if I did want to have in the future, then I would do like IVF. But other than that, no.
Okay. So that's important to know, because the question is, do we take out your ovary or do we try and remove the cyst from the ovary? And part of that has to do with kind of, you know, fertility and then, you know, what your desires are.
Right.
From my perspective, looking at your cyst, you know, the fact that you had an ultrasound in February and then had one more recently in May, and those are pretty similar in size, is reassuring to me, because it hasn't, like, you know, significantly grown or changed in a way that makes me suspect that there's a cancer there. Additionally, you know, we don't see these solid components or these like papillations that I'm talking about, and those things are reassuring. Okay. I do think that we should surgically remove this for you, because obviously it's causing you discomfort. It is large, and I don't think it's going away on its own. Okay. And so really the question is, do we try and remove the cyst itself or try and remove just the whole ovary? The advantages of removing the ovary itself are that, one, we get it out and it doesn't return, and two, it decreases the risk of there being rupture of the cyst. Okay. Whenever we're trying to kind of peel a cyst away from the ovary itself, there are risks that we could rupture that cyst, and that, you know, if there's something bad there, can cause spread. Again, my suspicion for that is relatively low. So, you know, if you really said to me, Dr. Levinson, I just really want to keep that ovary no matter what, and because I'm really planning on, you know, trying to do IVF in the future, then I'd probably say okay, but, you know, with the size of your cyst, there is a risk of that rupture. If you really think, you know what, IVF is not really a reality for me, and I'm not sure that I'm really going in that direction, then I would probably say just do the oophorectomy, because your other ovary takes over from a hormonal standpoint. Even if you were to want to do IVF, you still have the other ovary. And so the issue becomes, like, as you get older, so at the age of 35, we know that fertility starts to drop off. And especially between the age of 35 and 40, that road becomes much more steep, where that decline in your fertility becomes much more steep. And so for patients who are like 39, 40 and really looking to become pregnant, that becomes important, because ovarian reserve starts to decrease significantly, and us removing a full ovary can have an impact. At the age of 31, I don't think that that's necessarily such a big deal for you, but if you're thinking, well, in 10 years from now, I might still want to think about IVF, then yes, that could play a role that you don't have a second ovary. Does that make sense? So I'm comfortable with either, depending on kind of what you tell me. But, you know, if your thought is really, you know what, if I was going to do IVF, I'd probably do it in the next year or two, and I'm okay if, you know, I don't get 8 million eggs and I get, you know, then probably I'd say just remove the ovary.
Because my left ovary is okay.
Your left ovary looks fine.
Okay, so yeah, I don't mind taking that one.
Okay.
Because I don't want the pain. Because, like I said, the episodes are kind of scary. So I'd rather take it as long as I have other options.
And then the other question is, you know, if you're prone to producing cysts, you know, you always could go on like a birth control pill, for example, to try and just kind of suppress the ovarian function until and or unless you decide now I'm ready, just so that you don't get cysts on the other side as well. Because sometimes that, you know, your ovaries, since you've had this issue since 2015, may just kind of want to do this. And so, you know, that may be something that you could do proactively if you wanted to. Now, nobody likes to be on medication if you don't need to be, so I get that. That's kind of, you know, you got to think about that, but it is an option for you.
That's fine.
Okay. What questions do you have for me about anything?
I think I answered it. As long as I have my left.
Yeah.
You can take the right.
Okay.
I'm okay with
so
that.
I usually do these through one little incision in your belly button. It's an outpatient procedure. I will send your ovary off to my pathologist while you're asleep, just to make sure that there's no surprises anywhere. My plan would be that even if we were to find something unexpected, which again I think is very low risk, but that I would leave your GYN organs in place because of your age and your possible desire to do something further. What that means for you is, in the rare chance that we were to find something, it may mean that you would need a second procedure at some point. But I would wait until we talked about it to make that decision. Okay? All right, let's go ahead and do an exam, and we will get everything all set for you and get this on the books. All right, my friend.
So as you've heard, I am going to get my right ovary removed. So I scheduled my appointment for the removal of my right ovary. So I have a couple things I have to do prior to surgery with my primary care physician. So of course I will be recording that. So until then, see you guys soon. Good morning. So I am at my pre-op appointment. Of course my surgery is in about 2 weeks and I want to say 2 days. So I of course am going to be recording the whole process. So today what they told me at my last appointment is that I should be getting EKGs done, blood work. I'm not really sure what else, but of course I'm taking you guys with me, so stay tuned. Okay, so at my pre-op appointment, I am back in the room, and right now what they're about to do is my EKG. So I was trying to record that as much as possible. I'm not sure if that will have any kind of like effect with it or not. I don't know, but we'll see. Okay, so yeah, I couldn't hold my phone up because my tits were out. They had to go underneath of my boobs, so I'm just now waiting for the doctor to come in to let me know what else we have to do. And that was all for the actual visit. So now I just have to get blood work done, but I don't think I need to record the whole blood work process. So yeah, the next time I see you guys will be the day or the morning of my surgery. Good morning. So it is the date of my surgery. Friday and Saturday was a bit hard as far as like my mental status of getting a surgery. Like I just got nervous. Like I was in this like, I don't know, I kind of had this like I don't know, it was more of a I don't know what to expect kind of emotion. So it kind of put me in like a really uncomfortable place. But Sunday, yesterday, kind of got better from that. So definitely feel much better today. Felt much better yesterday. So yeah. So I am on my way to the hospital, waiting for my best friend to pick me up. And then I'll see you guys when I get there. So I'm in the back, prepping for surgery, waiting for them to come in and continue to like check me in and stuff. I am in my gown now and just waiting. So I am in hospital attire. I don't know if I have to take this off or not. IV and getting ready. I can't talk, but I'm on my way out. So this is a couple hours after my surgery. I've been sore just about all day. Of course, when I got home, you know, I was high off of pain meds, which I kind of sort of still am. I did take some Tylenol not too long ago. I'm waiting until 12 o'clock to take another dose of oxys, just so that I can sleep comfortably. So yeah, I'm gonna continue to do the updates until like just to give like, you know, how it felt after the surgery. And then I have my 2-week post-op appointment, so of course we're gonna do that. And then I haven't really decided at what point I'm going to upload this, but I'll probably continue to, like, I'll do it after my 2-week post-op, see how I'm feeling, and then of course work on getting it uploaded. And then from there, then I'll continue to update as far as, you know, how I'm still feeling after my 2 weeks, and then when it's time to go back to work. So hope you guys are enjoying all of the updates on everything, and definitely what to expect when you're dealing with ovarian cysts, because it definitely is one of those things where you got to pay close attention to, because this has been going on for years for me. But just last year, it actually gotten worse. It turned into, of course, me having polycystic ovaries to me having a hemorrhagic cyst on my ovaries. So it definitely can go from 0 to 100 really fast. So you just gotta maintain, like, keeping up with it, making sure that you are paying close attention to your menstrual cycles, the pain. Like, if you're experiencing pain during sex, please pay attention to that, because you're not supposed to be experiencing pain during sex. Yeah, it's definitely a lot of things, even with when it comes to like, you know, facial appearances like acne. That can definitely take a toll, to where at one point in time, like, my acne was really worse. You can kind of still see that I have like blemishes from when it was worse, but my face has cleared up tremendously since I have been paying more attention to my ovarian cysts and changing my eating diets to try to you know, minimize it. So definitely your eating habit and your diet has to change. Yeah, like I said, I will continue to update everyone on how I'm feeling, what I'm going through. I'm definitely not just going to upload just the goodness in it. I'm also going to try to give you as much real life experiences as possible. I do want to thank you guys so much for tuning into this video and watching this video. Hopefully it's not super long, but I hope it's very informative for somebody that is experiencing what I'm going through. So see you on the next update. So day 2, none of the pain meds are actually working for me. I took an oxy and it's not doing anything. Only took that probably about like almost 2 hours ago. The cramping never goes away. The cramping is always there. Yeah, so I'll try to take Tylenol. Like, I've been alternating, so I tried to take oxys around the time when it's time for me to go to bed, so it can help me sleep. Like, it actually helped me sleep last night. I didn't wake up at all, like, in discomfort, anything like that. Then I woke up and I took ibuprofen, and it helped a little bit, but like I said, the cramping is just there. So when this wears off, I'm going to try to, I might actually take the Tylenol while the oxy is kind of working, just to see exactly like what happens. I don't want to do too much, but I think the oxys is only like 5 milligrams, so it should be okay. But yeah, it's definitely hard trying to get comfortable. Like, I can't sit up because it hurts. Laying down sometimes it hurts. Laying on my side it hurts. So yeah. So yeah, that's day 2. All right, so we are at day 3. I'm feeling a little bit better. Of course, it's just that regular cramping. But today is the day that I take off my bandage. So yeah, I'm gonna take it off and look at it. So this might get a little what's the word I'm looking for? Extra. Because I am going to be recording it. So, yeah, let's see how this goes. So, of course, I have like, I mean, I always had a gut, but it's kind of like full right now. Because, of course, during the actual procedure, they had to blow my stomach up. So I'm trying to figure out a good way to do this without completely hurting myself. It's like one of those things that you're like, see, this is all like bruised right here. It's so like nerve-wracking. Then after this, I'm gonna jump in the shower so that I could kind of get like a good cleaning. Then it says upon the removal, like I don't really have to put anything on here. Whew. Okay, so because it's like dry, I don't want to put like too much. Looks like I do have stitches. No. Okay, not too bad. Okay, I got it all. Yeah, it's not too bad. Definitely has stitches on here. Can't really tell though, but yeah, so this is what it looks like. Looks like it's more swollen on this side than anything. So yeah, I'm going to take a shower and clean it off. I don't have to put anything else on here for right now, they said. So I guess if it does have that, like if it starts to bleed like crazy or anything, then yeah, we'll do it. But my belly button completely doesn't look like my belly button anymore. So yeah, here it is. They did a good job as far as the cleanup and the stitching. Just don't want to put too much. It's starting to bleed right there. So yeah, day 3. So those who don't know me know that, like, I'm not really big on asking for help too often. I tend to try to do things on my own. Always pushing myself to the extreme, doing a million things. But today kind of like calmed me down a little bit, only because I wanted to make lasagna. I've been like craving lasagna for the last couple of weeks, and I'm like, okay, I'm gonna make lasagna. I went to the market Tuesday and got everything, but then forgot ricotta cheese. And realized that today, trying to make it, and I'm like, okay, so it's just me and my oldest son here. So I was like, okay, well, let's just go drive, because I was feeling okay or whatever. Of course, like, probably like I'm still under the medication or whatever, but I was feeling fine. I drove okay. Like, the driving part isn't fine, it's just sitting for a long period of time. So I'm definitely feeling it now. And of course, like, I went to the store. The doctors, they don't want you to be laid in the bed. They want you to move around as much as possible, like walk around and stuff like that. So I definitely took that opportunity to walk. But I think I kind of overdid it. I went and I got my ricotta cheese, and I had to get like one more thing. And then I left, and then I've been wanting a snowball. Like, I'm like a snowball fiend. I have to have a snowball. So me and my son went to go get a snowball before we came in the house. And then I started cooking. So I've been on my feet for like a pretty long time, so now my body like hurts really bad. I took some meds, and it's kind of like taking a while for it to kind of work through where I needed to work through. So yeah, I'm in pain. Everybody, of course, is yelling at me like, you should have said something, I would have did it. And I'm just like, it's just one of those things where, like, I only needed one thing. Like, I don't want somebody to have to get out the bed or come out of their house for one thing. Like, and I didn't want to wait. So, I mean, I just did it. But yeah, I think I'm gonna just wait to even try to attempt to drive again. Like I said, the driving part wasn't the issue. Like, I could drive perfectly fine, I can brake perfectly fine. It's just the sitting. Like, with the surgery that I got, of course I had my ovary removed, but it also, like, they went through my belly button, so it's kind of like the lower half of my body kind of like bothers me. It's kind of like the worst pain. So just sitting for a long period of time will cause your body to kind of tense up. So that's what the actual pain is, outside of the actual surgery itself. So yeah, I wouldn't recommend doing, what is this, my 3rd day? So yeah, I wouldn't recommend doing anything for probably about like a week. So yeah, I'll just be in here trying to figure out how to better occupy my time. Sorry I'm laying down, but yeah, it just hurts to sit up. It hurts to lay down, but I'll keep monitoring what I do and what I don't do, and yeah, we're gonna move from there. Good morning. So it is day 8. Yesterday made a week that I had my surgery, and I don't really have any, like, for the last 2 days I haven't needed to take any kind of pain medication. I think the last time I took pain meds was Sunday morning at like 6 a.m. and then haven't taken anything since then. The only thing right now I have is like the mild cramping, but I normally don't take any kind of medication when I'm on my menstrual or anything like that. So it's kind of just normal cramping that I kind of just can deal with on a regular basis. So yeah, I definitely haven't needed to take any kind of medication or anything like that. I woke up this morning in a slight discomfort, just body aches and pain. So I'm going to take something to try to get rid of that. But other than that, I haven't needed to take anything as far as from my surgery. My incision is healing. I'll probably start posting something on that. Like, you can still feel the hardness on it, but once I get into something different as far as clothing wise, then I'll upload a video on what my incision looks like, and then what I meant by like the hardness that's around my belly button. But other than that, like I said, day 8, and we are good. We have our post-op appointment next Tuesday. So yeah, I'll probably upload an update on my belly button, and then if I have any other aches and pains, then of course I'll record it. But other than that, I'll see you guys at my post-op appointment. Good morning. So I am about to walk into my 2-week post-op appointment. We're going to, of course, check on my incision. They're going to ask questions, and they're going to show me the pictures from my surgery. So I'm super excited. So we are now in the room where we'll probably be doing an exam just to check the inside, just to make sure everything is good. So yeah, we're about to see what's happening. So I'll be getting an exam just to check the inside. So we're just waiting for the doctor to come in.
You feel like you're recovering okay from surgery?
Yes, I feel like the whole recovery part ended last week.
Oh, yay, I love that. You feel like you're back to your baseline pretty much?
Yes. I was telling her, like, this cramping comes here and there, but I haven't had any, like, pain medication in over a week. So,
awesome.
Yeah.
And bowels and bladder are good?
Bowels and bladder
no
good.
abnormal bleeding?
Nope.
Good. Mm-hmm. Awesome. Well, let's take a peek at you. As you know, all of your pathology came back benign.
Yes.
So that's awesome. And basically, we just got to make sure you're all healed up, and then you're good to go, my friend.